Walking in.
You go ahead, Jason. We just didn't see you pop on, so thank you for being here.
Good morning, everybody. I have been tasked with introducing our speaker today. Um, First, we're just really glad that you're here, number one, before more than anything. But Dr. Whitney Griffin is a licensed psychologist and clinical assistant professor at the Psychoeducational Clinic at North Carolina State University. In this role, she conducts comprehensive psychological and psychoeducational evaluations of students from elementary school through college to better understand their learning needs and provide relevant recommendations to support these students and their families. Dr. Griffin also provides supervision, support, and training to graduate students in the School of Psychology program at NC State. She earned a doctorate degree in school psychology at NC State University and also holds a master's degree in special education from East Carolina University. Her interests include autism spectrum disorder, intellectual and developmental disabilities, hearing loss, and the social emotional development of children, adolescents, and young adults. Whitney also serves as the educational specialist at the Carolina Institute for Developmental Disabilities in Chapel Hill, where she provides consultation and educational assessment services on interdisciplinary teams while while also mentoring graduate students at the Maternal and Child Health Leadership Education and Neurodevelopmental Disabilities program. Prior to becoming a psychologist, she worked as a special education teacher and autism specialist in the public schools for over a decade. So join me in welcoming Miss Whitney Griffin.
Thank you. So thank you so much for that introduction. And I will go ahead and get started with our limited amount of time here, which I will try to move quickly enough to leave some time for questions. But I will also be speaking on Thursday. So if we run out of question time today, I'll be back again for anybody who might be joining Thursday as well. So I've been asked to speak today about how students are identified or diagnosed with specific learning disorders or learning disabilities, and how the needs that they might have in the college setting, what that might look like and what their needs might be. So the goals today are to go over some of the common features of learning disabilities or disorders and how those diagnoses and identifications are made. Some of the steps involved in that process of determining if a learning disorder is present. Talking about how that might impact learning and participation at the college level, as well as some accommodations and supports that might be relevant and appropriate for these students. So first, to talk about what is a learning disability or disorder. Well, it really depends, how this is defined depends a little bit on who is making that determination. So I'm going to talk a little bit about the difference between when community-based psychologists are making this decision versus when this is something examined in the public school setting. And I do want to note that I am talking about a diagnostic process that is focused on deficits. It's a deficit-based model, but we are making strides towards talking about this as differences, not just disability, not just disorder, but because I'm talking about the diagnostic process and how we are looking at these particular areas of difficulties, I will be using those terms of difficulties, disorder, disability, but note that this isn't only about, these kids aren't only defined by their difficulties. So, but just for feasibility of language, those are some of the terms that you'll be hearing from me. So what this, hold on, let me, this is where I want to be. So for clinicians who are in a community-based setting, community mental health setting, in a clinic setting like I am. We're based in a university, but we're not a public school provider. We use the Diagnostic and Statistical Manual of Mental Disorders. It's currently in the 5th edition. So the DSM-5, that's our guide for making diagnostic determinations. And the focus in this setting is more on diagnosis. However, in the school setting, clinicians, those psychologists, school psychologists are trained in the DSM-5. Our major guiding practice is also bound by federal law. So the guiding document, so this will vary if you have out-of-state students, of course, but I'm focusing a little bit here because we're in North Carolina on the guiding the guidelines for North Carolina students, which in public schools, which is it's driven by policies governing services for children with disabilities. I'll refer to it as policies. It's a policies manual, and it's a freely available, lengthy read that our Department of Public Instruction or public schools have and update pretty regularly. That it's derived from federal law, federal special education law, and it guides the definitions and the procedures for determining whether or not a student might have a disability and require some special support in schools. So, when we're using the DSM, the definition of a specific learning disorder, it's specific learning disorder is the term, and the definition, making that diagnosis requires determining that a child has difficulties in acquiring and learning and using academic skills, despite having been provided some additional support as some early difficulties might have been seen. And those difficulties can span reading, writing, and math, both basic reading skills, decoding, fluency of reading, as well as comprehension of text and writing. It can be spelling or more applied writing skills, writing with appropriate grammar, punctuation, clarity, and organization of written expression. And in math, it can include difficulties from number sense, learning basic math facts, performing basic calculations and procedures, to that higher level mathematical reasoning and conceptual skills. The definition requires that the skills are substantially and quantifiably below expectations. It's a little bit of judgment here, but the skill should be below expectations for their age and or grade. And there's even a caveat that as students get much older, there can be a documented history of learning difficulties as opposed to just performance on a standardized assessment measure. Typically, the difficulties were present in the school age years. They were emerging there, but the point at which the disorder is really manifest and diagnosed can be a little bit later because it may not be really clearly seen until that child's the demands of the curriculum exceed that child's skills and capacities at that time. The other important point for a specific learning disorder diagnosis to be made is there cannot be a better explanation, another disorder that might explain the difficulties, or another situation, poor instruction, adverse family circumstances, not a lack of access to school, other so circumstances and other disorders that might get in the way. Now, in the public school setting, it's referred to as a specific learning disability, at least in the state. And the definition is a little bit broader. So it's a disorder in one or more of the basic psychological processes involving understanding or using language, spoken or written, that might interfere functioning. And I'm not gonna read through all of this. So still expecting that there's some difficulties with the reading, writing, or math, but there's a little bit of a broader context here. There may have been a brain injury that's causing those difficulties, and that's still conceptualized as a learning disability in the school setting. You'll see the term dyslexia here, and I'll come back around to that term, but that's another term that refers to a specific learning disability in a particular set of areas. And there's also a caveat here, similar to the DSM, that there's not another explanation that's a better explanation for the learning difficulty. So it's not that the child is behind because they weren't hearing the information properly, or they might have an intellectual disability or some other adverse circumstance that has been interfering with their learning. So putting that all together, what does that mean? For a student to have a specific learning disability or a disorder, they're having trouble learning and acquiring academic skills. There's not another explanation for why they're having those difficulties, or if there is something else going on, their difficulties are above and beyond what that other situation might have, the challenges that might have presented. There's been some attempt at providing some support, but it's not been effective enough. We think of a specific learning disability as a neurodevelopmental difference. And there's other terms that you might hear. So I'm using the term specific learning disability or specific learning disorder. Dyslexia is a specific term for when the specific learning disability is in certain areas. So difficulties with decoding and reading words and with spelling. When you have that particular subset of difficulties, that's dyslexia. Dyscalculia is a specific subset of difficulties associated with math difficulties. And dysgraphia is used to be used as a synonymous with a specific learning disorder in writing. However, the specific term dysgraphia is not a diagnosis that is made in the DSM. It's something that's talked about outside of the DSM as both difficulties with writing as well as with some of the motor output. So not typically a diagnosis that a psychologist would make on their own. There may be some input from occupational therapist or physical therapist, kind of better understanding some of the motor piece. But you will see that sometimes used to refer to a specific learning disorder in writing. And then, as I mentioned before, there's also efforts now to move towards not just talking about disorder or disability, but also just thinking about the more diverse nature of humanity. And you know, this is a way that kids are wired a little bit differently. So part of the neurodiversity. And so folks that kind of fit in this spectrum, their difference in learning being part of the neurodiversity and neurodivergence seen in the population. Okay. So how we make that decision in a community setting, our focus again is diagnosis. And I will say that doesn't mean all clinicians, including myself, are only focused on diagnosis. Usually we're trying to understand strengths, we're trying to understand needs, and we're trying to give some relevant recommendations to a family about supporting a child. But in terms of that child being able to access some support, usually we're looking at providing some kind of diagnosis to kind of capture that need. So in that process, we would gather relevant background information. And background information being their social and developmental history, understanding family circumstances, understanding some of their behavioral history, We'd also be looking at records. So we want to see what's going on at school, their grades, their test performance. For students in elementary school, they're often monitoring these students' progress more regularly, especially if they've been struggling a little bit in school, and there's data that that sometimes families are able to share with us, and so we like to see that. Certainly there's interviewing the family to better understand current concerns, as well as interviewing about history and interviewing the child to understand a little bit more about their experiences and things that are difficult for them, things that are going well as places where they're struggling. We will typically do a standardized assessment of academic achievement. That's where we're looking for how different their performance is relative to where it should be for their age or their grade. And then we may follow up in certain sub-skill areas. So if a child is struggling in reading, we might want to know a little bit more about some of the foundational skill areas that contribute to the development of reading skills, like your understanding of the sounds and being able to, that's your phonological awareness and understanding, being able to hear the sounds in words, play with the sounds in words, rhyme, make different words. That contributes to the development of literacy skills. So that might be a sub-skill area. There are others, it's just one example. It's not required for the diagnosis, but we'll often do a cognitive evaluation and collect other assessment data because we want to rule out that there's other potential contributing factors, or identify if there's any variability in their profile, areas of relative strength, as well as areas of relative difficulty in their cognitive functioning, memory functioning, language functioning that might be affecting a child's learning and skills. And then the ultimate determination is based on the data and clinical judgment. And then we're looking back to that criteria in the DSM-5. So that's in the community setting. In the public school, the focus is more on eligibility. They're not making a diagnosis. They're determining if a child meets criteria and is for a particular disability area and is eligible. So I'm going to pause here in just a second. So I want to introduce, there's two different ways that learning disabilities are identified in the public school setting. One is using a discrepancy model, and one is using what's known as response to intervention, or RTI. So I'm going to pause here. I don't know if I can see if I'm sharing my screen, so I might have to stop sharing, but I want to know if folks have heard of, aware of, know what discrepancy model, what I mean by that. So I want to know how much elaboration might be helpful here, or not. I can just move on. So if you've heard of, know of, familiar with, think you know what the discrepancy model is, in the chat box, if you can enter a 1, I hope I hope you guys are able to enter in the chat box. I hope it's enabled. I think it should be. And so enter a 1. And if you aren't sure what that is, what that means, discrepancy model, if you'll enter a 2, that will help me. So one is you have heard of it, you know, and a 2 is you haven't. Great. Okay. We'll put the mix here. Great. Give it just a couple more seconds, and then I'm going to ask a second question. Okay, so now my second question is, if you've heard of, know what response to intervention, what that refers to, what that means, you're going to hit a 1. And if you haven't heard of that, not sure what that means, you'll press a 2. Thanks so much. Okay, we have, figure out how to close my chat box. Hold on. I just need to move the chat box out of my way. Give me a second. Stop sharing. There we go. So I'm going to give just a quick overview, since it seems like there's a mix of folks who maybe haven't heard of these things. So I mentioned the DSM-5. Before the DSM-5, there was the DSM-4 TR and the DSM-4 and the DSM-3, and it goes back and back. And there's also been, as I mentioned, many iterations of the policies and procedures and the guidelines that guide access to services in schools. So earlier conceptualization and guidelines about specific learning disorders or specific learning disabilities conceptualized it as a discrepancy between a child's cognitive ability and their academic performance. And the definition in the DSM and the definition for public schools was to assess cognitive ability, assess academic ability, and then see if there's a discrepancy, if there's enough of a gap in performance that your academic skills are far enough below your cognitive ability, then that's what a learning disability is. So that's the discrepancy model. There's now a move away from that model to just conceptualizing it as difficulty learning academic skills, not necessarily a discrepancy between cognitive ability. And that's for a variety of reasons. Some being that sometimes the cognitive assessments are not always as reliable as we had once thought. And there's culturally loaded information there. So we see some differences in performance across different cultural groups, but other reasons as well. So the focus is now mostly on the academic achievement. And if kids are getting some support, not special education support, just they're struggling a little bit, so teacher gives them a little support, they have a little special reading group or a special math group or whatever, and they're still struggling, they're not their skills are not kind of on that trajectory as expected, and there's not another explanation. So in the DSM criteria now, we don't use the cognitive ability to make that determination. In schools, that transition to a new way of thinking about specific learning disabilities is a little bit slower to come around. So now there's still the old way, they're still looking for a discrepancy, but there's also a new way. And that's what response to intervention is. And what that means is if a child is struggling, we're going to try some different interventions and see how well they respond. See, here's where their kind of learning trajectory is. We're going to see if we can give some interventions and kind of boost that up and get them a little bit closer to where they should be. If we're trying to boost that up and we're not seeing a big change here, we're still seeing here's where they should be and here's where they are, then we're going to say that that's a specific learning disability. They're not responding like we would expect to those interventions, and they might need something above and beyond just some basic interventions in the class. They might need some special education services, and that's when that determination is made. And I will answer questions about that at the end, just kind of for the sake of time and moving forward. But that's a difference. So when you're looking at reports, when you're looking at data coming into college for how those decisions were made, you might see different information depending on the method that was being used in a school setting for making that determination. Again, in the school setting, when we're thinking, does a child have a specific learning disability, we're relying on that, the policies criteria or the guidelines for that particular state. And then it's a team approach. When a learning disability is identified in a school, it's not just a school psychologist making that determination. They're certainly providing a lot of the data, but the the general education teacher should have been collecting some data about how that child's doing in the class. There's parents coming to the table and talking about concerns and what they're seeing. There's a representative from the school There may have been special education teachers involved in some way, and either they might have been a part of an intervention group, but they're part of that decision-making process. So it's a team approach. So the difference in the school in terms of determining eligibility is not only does that child meet criteria for the definition of a specific learning disability, and these I have listed here, these are the specific areas that a child can be having difficulty in and be identified as having a specific learning disability based on the policies manual. So there's even a few slight variations here from what we can see in a community setting. One in particular, you'll notice there's, I can't see my whole paper here. So you'll notice we have basic reading skills and reading fluency. And we have basic math skills, but we don't have math fluency. So some kids will struggle with learning number sense and learning basic math facts. And we could make a determination that that's a specific learning disorder and based on the DSM, but just difficulty with learning basic math facts is not considered a specific learning disability in a school. So the slight little differences, that's just one I'm highlighting, slight little differences between the community and the public school setting. But not only do they need to have these particular difficulties in learning and acquiring skills, but it also must be determined that that's having an adverse effect on educational performance and that they require specially designed instruction to make progress. So this is back to that RTI, that response to intervention. If there's some special, reading group or a special, extra support that a teacher might offer on a regular basis, and they do that for that child and that works, and that child is, they were struggling a little bit, but now their skills are kind of coming along, then they might decide in that case that child doesn't require specially designed instruction. So to kind of reiterate that process in the public school, there's a need identified, there's an evaluation conducted, then the focus is eligibility. Are they eligible? They're not making a diagnosis, they're determining eligibility. Then they may develop an individualized education program or an IEP, implement that IEP, and then it's an iterative process. You're going to do some ongoing monitoring and see how well that child is doing with learning those skills. So when we compare those, I've highlighted a few of the differences, but the process for making that determination, it's much shorter in a clinic setting, in a community setting. There's typically 1 or 2 days of testing. There's certainly an extensive set of data that's gathered, interviewing of the parent, but we're not working with the child over multiple months and months and looking at interventions. We're kind of doing a retrospective review of what's been done. And in the public school setting, it's typically a lengthier process. There may be a few months. It can even go over the course of a couple of years. It may be that there's some interventions taking place in that child's classroom and that child is doing pretty well. And so the team decides, oh, we're not going to call this a specific learning disability. And then, the next year, there's some additional supports and they're not enough. And that child starts falling further behind. So that process might be revisited over the course of a couple of years, and that determination of eligibility might not take place for a while. It doesn't mean they're not doing anything. It just means it's that distinction of whether or not they're going to determine that child meets the criteria for eligibility versus they're able to support them in other ways. Again, we're guided by the DSM in a clinic or community setting where it's federal and state guidelines that set the procedures in the public school, and the school is making those decisions with a team. Whereas in the clinic setting, it's often just a clinician, maybe a small group, but a little bit more. And with parent input certainly, but the decision making piece is not team driven in the same kind of way. Okay. So I'm going to just give a case scenario here. I'll give you a moment to read through this, or maybe I'll read it out loud just in case that's helpful for anyone. And then I'll ask a question afterwards. So Leo is a middle school student who has been struggling in his math classes. Math has always been hard for him. He just can't seem to remember how to do some of the calculations. He has worked with a tutor since 4th grade. Leo has not passed his end of grade tests in math from 3rd through 7th grade, and his grades in math have always varied between proficient and not proficient. He has also been getting extra support in a special math remediation group at school and attended a math camp the past 2 years to help improve his skills. So my question, and I'll let you respond on the chat, is does this seem like a child that we might be considering a specific learning disorder or a specific learning disability? That would be a yes. And if not, that would be a no. And then if there's any questions or comments, you can make those in the chat box too. I'll watch the chats here. And if no, I'm wondering what other information you think might be missing. You don't have to say it. I see a lot of yeses here. You know, it's not always a right and wrong here with these determinations. But what I'm setting up here for you is that we have history here of difficulty in an area that's relevant for a specific learning disorder, and a history of interventions and supports that have been put in place. But this child is still struggling. Now, there might be other factors that that I didn't provide here, right? There might be other details that might move us in a different direction. But given the information here, this is a scenario where we might be expecting that a specific learning disability or specific learning disorder is the part of what's going on. Okay, someone would want more information on proficient and not proficient. Yeah, that's a great point. We want to know more what those grades meant. The grades used in public schools in this area, especially in elementary school, certain grades are if you have a 3 or a 4, your skills are considered proficient. If your grade is below that, that means that the teacher is making that determination that you haven't shown proficiency with a particular skill. That's a great question. You might want to know a little bit more about the grading system and what exactly that means. Do we have any other data? Great. All right, let's look at this. Gina is a high school student who's been having significant difficulty with the ACT and SAT. She's been working with a tutor over the past year, but her scores just don't seem to be getting better. She finds that she runs out of time, especially on the reading sections. Tests have always made her nervous, and though she usually passes them, she did score below expectations on her 6th grade end of grade test in English language arts. Her favorite subjects are math and science, and she does not like English and history. So given this information, if this sounds like it might be a specific learning disorder, 2, if not, and if not, what are some things that you might want to see, some other information that might be helpful to see? Great. I see a couple of folks noting that there's a history, it seems more about anxiety. Yeah, we're missing some information in the history. So any strategies been provided? Great. Give another couple of seconds there. Yes, yes. So these are great comments and observations. Thank you. So this is something that I do see in the clinic. A high schooler and sometimes a college student might come in and they're struggling with one particular class or one particular thing, and the parent is really worried there might be a learning disorder. So given this set of information here, this alone wouldn't lead me in the direction of that diagnosis. Now, that doesn't mean that this child doesn't have a specific learning disorder, that determination might not be made. As some of you mentioned, we might want to know a little bit more about, have some interventions been tried? We might want to know a little bit more about history. Is there maybe a more compelling history that some other places that this child has been struggling? So sometimes there could be more information we would gather in the history that could lead us in that direction. But when we don't have a history of not acquiring skills at an adequate level along the way, when we don't have history of clear interventions provided, that makes it harder to make that diagnosis. And yes, anxiety might be one thing that we would be thinking about for this student. Great. So when we have students then coming to the let me see, did somebody have a great. I see some other comments about other areas of difficulty we might want to follow up on, maybe reading comprehension, test taking skills. Excellent. So when a student is coming to college, what are some of the records that might be helpful for review? I'm just going to go over there. You'll get a lot of assessment reports, and there's lots of information in those assessments. So these are just some of the examples of standardized achievement tests that might be reported about, particularly if a assessment's happening in a clinic setting. But also we use these in the public schools as well. So some of the standardized achievement tests are the KTA3, the WIAT-3, just came out with the WIAT-4. There's also, I'm not going to read through all of these, but just ones that you might see pop up in tests, the cognitive assessments, the WISC-5 for older kids. We might see the WAIS, that's an adult intelligence scale used for ages 16 and above. The DAS, the WJ-4, the Woodcock-Johnson makes both an achievement and a cognitive assessment, as well as a language battery. So there's a lot of, if you see Woodcock-Johnson, there might be a couple of different kinds of assessments that are being used. And for some kids, you may even see a nonverbal intelligence test. You'll see those are appropriate for kids who might have some language differences. So when I mentioned supplemental assessments, these are just some examples of areas where follow-up might have been made to see if there's some underlying skill deficits that would be relevant for a child with learning difficulties. I brought up phonological processing. We can also see difficulties with orthographic skills. That's those are overlap with or kind of implicate spelling difficulties. There's some Pfeiffer assessments that provide some nice follow-up in reading, math, and writing. Key Math is another good math follow-up assessment. Then we might also follow up with oral language batteries, especially for kids with language-based learning difficulties. There may be co-occurring language issues, and they might be identified by a speech language pathologist, but there are also clinicians such as myself might look at language a little bit more broadly. And so there's some just examples there of assessments. And then for kids with motor difficulties, there might be some, even though that's the expertise in motor functioning might be more in the domain of a occupational therapist or physical therapist. Psychologists do have some training in that area as well. So you might see some assessment and follow up about a child's motor coordination and speed, their visual motor integration, which will be relevant to note-taking skills. And in the school setting, there's some different assessments as well that are used for progress monitoring. So you might see these things pop up on reports. You might see them in records that are shared. Other helpful information that might be helpful in making decisions about the supports at the college level would be certainly full reports where all of the information that's collected and data and everything is there, not only psychological or psychoeducational, but also speech language pathologists or occupational therapists might have some helpful information for guiding supports. Academic records and report cards, those are helpful. Certainly if a child has been already getting special education services, knowing what that individual plan looked like. There's other special education records that might have summaries of previous assessments, if that's something that you're trying to look back and review. And then not every child receives special education services or receives them for the full time when they're in public schools. Sometimes if they're doing pretty well, it might be determined that they just need some accommodations. So another way to get those, and I'll talk about this also on Thursday, but it is a 504 plan, and that's an accommodation plan that can be set up in the public schools, and often can translate really nicely to the kind of accommodations that might be available in the college setting. Okay, so how do learning disorders present? I've talked about some of the criteria there. So certainly we would see some signs of difficulty with learning, but that diagnosis might not have happened in elementary school. There can be trouble with the foundational skills in reading, writing, and math, as well as with application and understanding in those skills. And it can just be in one area. It can be in a couple of areas. So it might just be trouble with the foundational skill. It might just be trouble with application of that skill. It might be both. It might just be reading. It might be reading and writing. It could be reading, writing, and math. So it really kind of depends on the kid how that looks. A very common one that goes together is trouble with decoding, reading quickly and accurately, and spelling, and that is as I mentioned before, that dyslexia profile. Okay. But what that might look like in a college setting, other than like clear differences in those areas in which the learning disorder is identified, you might see kids who are having trouble keeping up with a really high volume of reading. Sometimes the demands in college are different than what they looked like in a public school setting, and there may have been more supports or accommodations available there that are not necessarily always appropriate once a child gets to the college setting and does need to learn the curriculum for a particular major or particular course. So we might see difficulty communicating clearly in writing. There might be grammatical errors, punctuation errors, writing styles a little bit disorganized. These kids, because the demands are higher, they might have trouble completing assignments on time because they may need more time to spend editing and working on assignments. And there also may be some inconsistency in their understanding. They might seem like they got something, but then the next time they come to class, they've kind of forgotten it, or they're needing additional practice and kind of a relearning in certain areas. Oftentimes, kids with learning disabilities have learned a lot of compensatory strategies, but that gap from high school to college, there's a different level of demand and a different level of expectation. So sometimes some of the strategies they were using, they either forget to keep using, or they need even maybe a little bit more. So, and we'll talk about some accommodations and supports that are relevant. You might see poor note taking, and that can manifest in several different ways. So the information that they're writing down might be incorrect. You know, they're spelling it wrong. They're getting offline, and it's not making sense. They might not be sure what to write, especially if there's a lot of lecture, and they might have trouble keeping up. So they're not getting it all down. And then for some kids, they might have trouble reading it later, particularly if there's any kind of motor issues, or kind of as a result of all those things, not keeping up, and they're trying to go so fast that then it might be hard for them to then utilize those notes later. And then we can see careless errors. So errors in math calculations, errors in grammar, punctuation, spelling, particularly if there were some difficulties, if their learning difference involves some of those more basic skills. But in addition to some of those academic pieces, there's other differences in their behavior that sometimes we might see. There may be more limited participation in class. They might be shy, or lacking some confidence, or feeling a little bit self-conscious, and that could affect their grade in the class in which participation is expected. They may be avoiding speaking out in front of the class or giving presentations. There may be some anxiety or worry about working with others, and somebody else kind of seeing that they struggle in some particular area, or just more generally some heightened anxiety. And there's there's a higher risk for anxiety, depression, other kinds of difficulties when there's differences in learning. I'm sure that a lot of you have used many different things and may know more strategies and accommodations and supports that I could name you, but I will. So I'm going to highlight a few, and then I might have some folks jump in on the chat and list a few other things that they've used to share. That might be a resource for others. Certainly, for kids who struggle with reading, accommodating reading is something that can be really helpful in college. So access to audiobooks, access to e-readers, technology that will read text aloud. And this means sometimes some interfacing with professors, because not all books are electronic or have the availability to get an audio version. So some communication and support there might be helpful. Having someone read the materials or information aloud in class can be helpful. Making sure copies of notes are provided. That's a very simple, simple in some cases. I know not always for the professors or instructors who just want to lecture and don't have anything pre-planned, but somehow either from another student or from that instructor, getting copies of notes can be really helpful and take a little bit of the pressure and anxiety off of students who are who are trying to take notes, but they need kind of a backup plan. I know it's harder to control this piece, but whenever you're talking with other instructors in your locations, using varied instructional strategies, not lecture alone, is certainly that's helpful for lots of kids, lots of students, not just students with learning differences, but can be another avenue for learning information a little bit more solidly. Lecture time, that's another one that's pretty easy to offer, but not only for tests, in class assignments, sometimes that's if the instructor can give extra time or let a student stay after class or take something and bring it back, as well as extra time to respond. A lot of students with learning differences process information a little bit more slowly, and they are willing to participate, but they need a little extra time to think about something. So even asking them a question, saying, I'm going to come back to you, can give them a way to participate without so much pressure. separate setting for testing. That's helpful for a variety of reasons. For some kids, of course, it helps them focus better, but some students get really self-conscious when they're working at a really slow pace and seeing everybody around them finishing up. And then and when we're anxious, we don't focus well, we don't think well, we don't retrieve information as fluidly from our memory. So that can be a helpful accommodation for a lot of those reasons. Access to support materials, certainly a really simple one, for students with math difficulties, and just having a calculator when the focus of an assignment or task is not the actual procedure, but is maybe a math problem solving. And so we want to kind of free their mental energy up to be able to engage in the math problem solving aspects and limit some of the careless errors. Access to a dictionary, word processing. There's certainly a lot of great technology that's available to support note taking, to support reading, text to speech, speech to text. That can be helpful. Having the ability to type rather than write. I know sometimes there's some old school instructors who want handwritten things, but that the technology available, even just spell check and basic word processing can make things a little bit more accessible for some students. And a lot of schools, of course, have other supports available. So when there is access to a writing center or tutoring, these things can be really helpful for students who have learning differences. Another thing, though, is being kind of planful and thoughtful in how that student's course sequence is planned out. There may be a student that would do better with a lighter course load or a lighter course load certain semesters. Giving them a preference with course selection, we want to take away barriers, right? So if it's a student that knows they focus a little better a certain time of day, and there's a few different times when a course can be taken, and they have the ability to maybe get in with a professor they know they work well with, or with a time that might work well with them. Giving them that priority of preference can be helpful. And then they might need a little guidance in developing their course sequence. I particularly in math, when students struggle with math and they have lengthy gaps in instruction or lengthy gaps, and they don't like math, so they want to put it off and take that very last thing. But we want to make sure that they're kind of taking things in sequence and not leaving lengthy gaps in an area that might be more challenging. And there may even be times when we have to be really thoughtful about whether there could be an alternative course that could meet requirements for a student that has difficulties in a particular area. So I know this isn't always an option, but the more planful and more individualized we can be sometimes in that support can be helpful, and help students, who are quite capable, be able to do what they need to do to get through this program. And, we want them to graduate and be, successful, engaged members of our community. So the things that we can support them to get there. I know modifications are not always reasonable, but sometimes they are. So some things that can fit well into a lot of courses are, for example, allowing an oral presentation, allowing maybe a small group or an individualized setting when for participation, giving a little bit of extra support when they're going to be joining into a group, maybe giving a student a particular role that they're going to play. Not penalizing for certain errors. If we know a student has dyslexia, we want them to go to writing centers, but we're also maybe going to focus more on their content and maybe not penalize so much for some of the errors that we know they're going to be more prone to. And some professors are, are willing to allow for partial credit or opportunities to revise and resubmit. I know that's not always feasible, and it's not always the best fit, but that's something that you might consider in some of the more individualized supports for students. So And then finally, just thinking about like helping these students be the advocates for themselves. Then some public schools really nicely transition students into being more independent, active, engaged participants in their educational program. And so they've participated in the development of their IEP by the time they leave school. They know their needs, they're ready to go. But the way that it's set up that doesn't always happen. Sometimes teachers and parents have been running a lot of things for these students, and then they come to college and they don't have those self-advocacy skills. So the things that whatever you can do to help them develop some skills to talk about their needs, to write up a script that they're going to use to go and talk with the professor. Certainly study skills instruction, and there's specific strategy instruction that can be helpful for students at the college level too. And I'll give a few resources for those here in just a second. So I had a case scenario, but because we're short on time and I wanted to be able to answer questions, we're going to skip that. And what I would like, there's the last part here is just some articles and information and a few pieces of reading that I thought might be helpful, as well as my contact information. But I'm going to stop here and have some folks chime in with the chat, either with other strategies they have found or resources they might like to share, or questions for me. And I'll try to get to a few of those. I'm willing to stay a little bit late here, but I don't know if there's another session right after this. So someone might have to give me a little guidance here.
There is not another session, so if you need more time, go for it.
So any questions or any resources?
I have a question. Can you hear me?
I can hear you.
I'm well. I just was going to say thank you for your presentation. I really appreciate your breakdown, the two different perspectives from the diagnostic versus the primary and secondary eligibility review. We've had a lot of new folks in our disability support services offices over the last couple of years. So I think it's been a really good opportunity to see that and hear that.
Great.
And just appreciate your time with us. Thank you.
Thank you.
I had a question about reduced course load.
Mm-hmm.
When is that an accommodation rather than an advising conversation? And if you can't answer that, maybe some of my colleagues can. Usually we just counsel them to maybe choose, taking 9 hours instead of full time, because a lot of students are determined to take full time. But when is it an accommodation, when we approve it on their plan and make it an official accommodation?
So I can't answer, and I have that included as an accommodation or a support, because I realize some of these might be official in terms of a documented accommodation, and I could see that being something that you is a support, something that you offer as guidance. But I'll see if any colleagues know specifically like what's allowable as an accommodation there.
Carla, what we've done at AV Tech is we've written not an accommodation like to the instructor, but we've done advising accommodation letters that let the advisor know that this student should not take more than X amount of hours after we've worked with the student, just because our advisors will more heavily focus on full-time enrollment, and that's not feasible for everybody. So this helps the student feel more comfortable advocating that they need to be part-time.
Okay, that makes sense. Thanks.
Thanks for chiming in.
I will second that. I do something similar. This is Monica at Alamance. I kind of tag team with the academic advisor and kind of do a prep session with them about the student and kind of what's in the best interest as far as course load.
And this is Holly Wagner again. I would just say, great ideas from Heather and Monica, and we could definitely do the same here, but just to keep in mind that there are other guiding principles that will help inform students of the decisions they're going to make, most particularly financial aid, right? So this would be another one of those case-by-case situations where we just want to be sure that we're really documenting the advice, the guidance, and the options and things that we're talking about with our students, keeping them as informed as possible, as what we feel sets them up for the best possible access and support, but knowing that there are going to be other pretty big guiding factors that will most likely inform their decisions that are out of our control.
Any other questions?
Hi, Dr. Griffin. This is Laura Bracken from Surrey Community College.
Hi.
And I just have a quick question or just some clarification. I know you had mentioned in your PowerPoint about extra time on tests, and I understand that concept, but also there was a mention about assignments. I know sometimes that can get tricky.
Mhm.
Can you kind of clarify that as far as a time frame that we should set, or just kind of let the student guide us?
Well, I think, it needs to be reasonable, right? So, in my experience, if you allow too much time for an assignment, then they're past the point at which that's the learning opportunity of that assignment. But my concern would be an in-class assignment that the student can't quite get done in that class, but could they stay after class? Could they schedule the time to finish that up, within that day or within the next couple of days? Should they have an entire month to work on a 1-day in-class assignment? That's probably not reasonable and not going to be helpful to them in the scope of learning within that class. So I think it would have to be individualized for the student. My main concern would be sometimes there are things that instructors give a student to do within the context of a class that they think there's plenty of time for, and some students who work at a much slower pace need that extra time, and plenty of instructors will just let them stay after, or let them take it with them and turn it in some other time. But on occasion you have to document that's something that should be offered to them, that they need particularly for those instructors that are maybe less flexible without a plan or a accommodation.
Absolutely, I agree. I agree. And the thing I get from my instructors is, as a matter of fact, it was the case kind of today or this morning, is they'll tell me, well, Ms. Bracken, the assignment is open and it's out there and they have until X amount of days to get finished. I recommend they start on it early. And of course I do tell my students, plan ahead and work ahead, but there's always, like you said, case by case where they might need that additional time. So, but that kind of helps clarify. I always try and document before doing anything. Thank you so much.
You're welcome.
Dr. Griffin, this is Monica Isbell at Alamance Community College.
Hi.
Thank you so much for your presentation. I appreciate it. My question is, how do you encourage students to use assistive technology or assistive devices? And I'm thinking of, I'm going to use note-taking.
Mm-hmm.
And I've said to students, when you get out in that work world, are you going to have a note taker in that meeting? So let's set you up with learning how to use a LiveScribe pen. Or let's get you comfortable with using text-to-speech software.
Mm-hmm.
And not necessarily expecting someone to read test questions.
Mm-hmm.
How do you encourage that, especially when they're coming out the public ed environment where they're reading the test questions aloud or they're doing those things? How would you encourage a conversation with the student?
Yeah, that's a great question. And I think it speaks to the challenge. There's lots of great accommodations, but then there's lots of students who don't necessarily want to use them. They're not comfortable to use them. They're not motivated to use them, or they don't seek them out. There's even, of course, a lot of students who don't identify, they don't disclose when they come to college. So they're struggling, but we don't even have a way to give them support. I think I don't think there's one right answer, but I think some of the things that you already mentioned are things that I would do, which is to connect the use of that particular strategy with how it's going to be useful in the future. So helping make that connection here, it's not just about using that now, but here's how it might work here. I think making sure that there's some kind of way to for them to trial something or see what it looks like, or to develop a little bit of comfort, because there's always going to be a little bit of hesitance or anxiety about using something new. So if there were someone that's someone else that's using it, or some way to model it, or some way to give let's try this for a week and just see how it works, I think that could be helpful. I think that the guidance that you're already giving, yes, somebody reading it aloud to you is great, but that's not always going to happen. So what's the next step? How do we help you become more independent? So having those discussions can be helpful. This is not something that I've ever used or done, but I will, as I'm talking to you now, what I know is helpful for some students generally is seeing other people with similar needs who've gone on to be successful. So I don't know if there's a way to connect students with other students who've used something with some success, or who've gone on to do something with some success, or someone who's working in the professional world who uses something as a tool effectively. But if there were a way to help students see that and make that connection, I think that would make it more feel more accessible, and seem more like not just them about their struggle, but about how lots of adults move on and develop independence and use strategies. People use these strategies, dictation and some of these other tools. It's not just people with learning differences.
Correct.
They're good tools. I mean, we all have our strengths and our needs. I would love to love audiobooks, but I need to see it. So I know what's going to work for me, and other students have their kind of profiles of strengths and areas where they're maybe not as strong. So helping maybe normalize that a little bit, I think could be helpful.
Okay, thank you.
Mhm. Any other questions? Thanks, everybody. Thanks for the comments. I'm just skimming through to see if there's anything to point out here. I'll just end there with the Q&A.